Welcome back. We're discussing the state of Canadian mental health. And specifically in this segment, we're going to talk about adolescents and how they're faring, especially as we're on the other side of COVID, hopefully. And joining me again is Dr. Taslim Alani-Verjee. Dr. Alani-Verjee, the federal government recently announced that they were going to be increasing the Canada Health transfer by $25 billion. What is your initial response to that? Is that a step in the right direction?
I mean, more funding is always a step in the right direction, but my question is always, where are those funds actually going to be spent, and how does that translate into direct services for the people who need them?
So where would you like to see these funds being spent? Because obviously, and my previous guest mentioned this, that's just general healthcare funding. It's not earmarked specifically for mental health. But I do have faith that a lot of provinces do recognize the mental health needs in their citizens in their province, and they're going to disperse those funds appropriately, or at least as they feel the need is. So where would you like to see those funds go?
Yeah, I have a feeling that when there are funds earmarked for certain parts, for example, for mental health, we see task forces created. We see a bunch of funding put into higher level programs that don't necessarily translate into direct services. So what I would love to see is at least some of that money earmarked for direct services. So right now, most mental health services are privatized, which means that those who have access to benefits or those who have the funding are able to access those services more easily. Through the community where you might not have to pay, you're looking at pretty long wait lists and pretty short-term therapy. And so if there was some sort of program in which, clinics or practitioners could apply for funding that would work similarly to OHIP for those who would not otherwise be able to access therapy, I think that would be a great use of funds. Being able to cover some portion of the funds would also be great so that it does become more accessible to all people. Or alternatively, reducing the amount that an employer has to pay into the benefits programs that they offer so that more and more employers are likely to offer adequate mental health care services as part of their benefits packages. I think all of these things would translate into more people being able to access therapy.
And I mentioned this again with a previous guest. I still don't understand why mental health care is compartmentalized almost separately from general health care. To me, it's all one, it's all health.
I would agree with you. I think historically, given the amount of stigma that comes with mental health, people have not wanted to talk about it. They've seen them as different things. People can be healthy even though they have part of their mental health that is struggling. And because we don't like to talk about it as much, when we've thought about things like budgets and federal funding, it has been easier and safer to think about mental health as separately and only for those people who are struggling and in need, as opposed to seeing it as something that we all have to take care of, just the way we all have to take care of our physical health.
So if you were to rate, and you're based out of Ontario, so if you were to rate, say, for example, in Ontario, and a third of the country's population live here, so it's a good sample, if you will, how would you rate the care offered to help people here in this province?
I mean, that's a big question. So I think one of the things that we're seeing more and more in Ontario, and we're seeing it across other provinces as well, is this privatization of services. Now, in Ontario, we know that most people are able to access services through private healthcare clinics, such as my own. However, when it comes to the publicly funded system, and when we're talking about adolescents, we're talking about 6 months, 1 year, 2 years, 3 years of a wait before people can access the services that they need. Even in the private system, people are having to wait. It doesn't make sense because often when a person is reaching out for these services, it's because they are in need right now, much as the way you would reach out to a physiotherapist when you're having a physical pain in your body. Right. If you have to wait 6 months to see that physiotherapist, it kind of doesn't make any sense. The way the system is structured right now, people can't engage in preventative care because there isn't the time and the resources to do that, but they also can't necessarily engage at a time when they actually need it because the system isn't equipped for that either.
Almost seems like it's a catch-22, and we need to break that cycle for certain. Dr. Alani-Verjee, thank you so much for your time today, and we'll have to have you on again in the future.
Thank you so much for having me.